Given the recent changes in modeling as it relates to surge capacity and national supply as the needs of other states diminished, and following weeks of discussions with hospital leaders and medical providers, I believe Georgia is positioned to secure the necessary personal protective equipment for healthcare facilities to resume elective surgeries deemed essential. Hospitals should continue discussions in their regions to ensure patient safety and the safety of their workforce, making sure that is a priority. I want to applaud all the hospitals, ambulatory surgery centers, doctor's offices, dental offices, physical therapists, and healthcare professionals that answered the call of duty and voluntarily closed their doors. It is impossible for me to adequately express my grateful appreciation to you all. And to all of the Georgians who waited on getting an important procedure to allow us to get to the other side of this curve, I also would like to thank you. Your sacrifice literally helped us save lives. Given the favorable data, enhanced testing, and approval of our healthcare professionals, we will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday, April the 24th. Unlike other businesses, these entities have been unable to manage inventory, deal with payroll, and take care of administrative items while we shelter in place. This measure allows them to undertake baseline operations that most other businesses in the state have maintained since I issued the shelter-in-place order. This measure will apply statewide and will be the operational standard in all jurisdictions. This means local action cannot be taken that is more or less restrictive. Over the next few days, we will continue to closely monitor existing and potential hotspots in our state. I stay in regular contact with local leaders across Georgia, especially those in Dougherty County and surrounding counties, to ensure that we are providing adequate support. Right now, in Albany and Dougherty County, we are seeing great improvement. I talk to Commission Chair Chris Cahias on a regular basis to ask if further action is warranted. And rest assured, if any community needs the state to intervene, we will do so with their input as well as their partnership. Now, the next point is a very important one. The entities which I am reopening are not reopening as business as usual. Each of these entities will be subject to specific restrictions, including adherence to the minimum basic operations, social distancing, and regular sanitation. Minimum basic operations includes, but is not limited to, screening workers for fever and respiratory illness, enhancing workplace sanitation, wearing gloves and masks if appropriate, separating workspaces by at least 6 feet, and teleworking where at all possible, and implementing staggered shifts. Subject to the specific social distancing and sanitation mandates, theaters, private social clubs, and restaurant dine-in services will be allowed to reopen on Monday, April the 27th. We will release more information over the next few days. Bars, nightclubs, operators of amusement park rides, and live performance venues will remain closed. In the days ahead, we will be evaluating the data and conferring with public health officials to determine the best course of action for those establishments. By taking this measured action, we will get Georgians back to work safely without undermining the progress that we all have made in this battle against COVID-19. Today's announcement is a small step forward and should be treated as such. The shelter-in-place order is still active, and will expire at 11:59 p.m. on April the 30th for most Georgians. We urge everyone to continue to follow CDC and DPH guidance by sheltering in place as often as you can. Limit your travel and limit who goes with you on errands to prevent potential exposure. If possible, wear a mask or covered clothing when you're in public to slow the spread of coronavirus. For the medically fragile and elderly Georgians, make plans to shelter in place through May the 13th, the date Georgia's public health emergency expires.